Dr. Mahlangu, we heard from you in the previous session about informal markets, but now we want to switch and ask you about your role in the African Medicines Regulatory Harmonization Initiative, which was at its very early stages of almost infancy when the previous report was written. So we want to ask you, what have been the experiences in the last few years? What have been successes that you would call as notable? And more specifically, is there something we can learn or see from its change to the time to achieve market authorization? Has that decrease, increase, remained the same? Has something changed around it?
Okay, thank you. So the African Medicines Regional Harmonization Initiative was born out of what Lambert said, that no one can do everything on their own. So it was intended to ensure, to work towards regional economic communities on the continent, working together to harmonize their primarily registration requirements initially. That was the main focus of the program. And it is driven by a unit that is sitting at the NEPAD agency, the NEPAD agency being an African Union agency. The first of the regional economic communities to be supported was the East African community. They received quite substantial funding, and they were able to develop common guidelines, common standards, and then also started working towards collaborative registration processes, as well as joint inspections. Out of that also arose the SADC collaborative registration process, which is known by the acronym of Zimbabwe, because the countries that initiated it were Zambia, Zimbabwe, Botswana, and Namibia. Those were the first countries to participate in that collaborative initiative. The third one that has been funded now is the ECOWAS region, which I think is only just starting their efforts. So between EAC and I think the SADC one, which is Zazibona, there's been quite a lot of movement. So we've seen a lot of capacitation of the agencies themselves. The fact that you are working together to do joint collaborative, particularly registrations, allows you to build trust amongst each other, to understand how the other agencies actually operate. Well, also adopt a common approach to working together. So we found that also the NEPAD agency worked on a model law for medical products for the African continent, and that they've been trying to encourage all the member states on the continent to adopt that model law again, so that we already have a harmonized legislative framework for everybody. But the success, I think, of these initiatives has been in building capacity and building systems, I think. A lot of us were not tracking the work that we're doing in regulatory agencies. The application would come, well, it would take its time through the process, and no one would track it. People would leave, and you wouldn't know where the application was. But what this has done is that now we have developed tracking mechanisms within our agencies and within the initiatives themselves, the regional economic communities, where we're tracking where the various applications are. And what we've seen, certainly the one that I can talk about, is the Zazibona initiative, because we have been the coordinating country for that particular initiative. And for Zimbabwe, we've seen the timelines drop from 3 to 5 years to 10 months to registration. So there has been some movement there in terms of bringing in efficiencies to the process to reach a regulatory decision, not necessarily marketing authorization, a regulatory decision where we close off the products. In fact, the Zazibona initiative which has been running for the last 5 years, has processed over 200 applications during that time. 60% of the applications were positive opinions, and the other 40% were split between withdrawals of the application itself and rejection of the applications. What we have not been extremely good at is then ensuring that the decision that is taken at regional level is actually translates into a decision at country level. So this is something that in the next 18 months, we as a region want to work on, so that we make sure that we see the actual results coming through at country level, because the decision to register or to give marketing authorization still resides with the country. With the EAC mechanism, they've adopted a centralized approach to applications, so they've started receiving quite a number of applications centrally. I think they're still debating on the mechanisms of how do you finance this, how do you share the resources that come through that process. That is still not clear. It's still something that is to be debated. But for the SADC countries, all we require is that you should at least have two applications in 2 active member states. Now, SADC comprises 16 now member states. Not all of the 16 member states are actively participating, because some are very small countries. They don't even have agencies. And so what we have said is you can participate as an observer, a non-active member. You can receive the proceeds, the reports that we produce for your own decision-making purposes in country. But you don't necessarily have to provide the assessors that will come and do the assessments. The assessments are done on a quarterly basis from the common applications that we have identified in the process. So as I said, we have seen the timelines really drop quite significantly. That has been supported by GMP inspections. For us, I think I said earlier on that because most of the applications we see are from India, mainly India. So, and we need all the countries themselves were doing individual inspections. So now we do one joint inspection, and the inspection report is available to all the 15 countries. So companies don't have to have 15 different, well, it wouldn't be 15 because some of them don't do it, but you wouldn't have at least 8 different countries coming to do an inspection. It would be just one set of inspectors that come and do the inspection, and the inspection report is shared. And it's a risk-based inspection, because for some of them we've decided that we do desk reviews rather than do full-on inspections. But as I say, we now have key standardized requirements for registration, which we hope that this will impact positively on market access.
Question similar to what I posed to Anban, which is, of the multiple activities that you describe, are there some that you think are lending themselves more for regional cooperation and some which are proving to be more difficult for regional cooperation?
Yeah. So the initial impetus for the initiative was focusing on registration, applications for registration. But when we have looked at, as we were developing a broader mandate for the continent with the AMRH, and that is to establish an African Medicines Agency. Now, in looking at what it is that an African Medicines Agency can do, we then had to look specifically what are those things that need to be done at national level, what can be done collaboratively, so that those things that are done at national level remain the responsibility of the national agencies. And these are things like your market surveillance. When we were discussing the African Medicines Agencies, there were countries we have challenges, I think, political challenges in country to have effective agencies that we're hoping that the African Medicines Agency could come and do their market surveillance we quickly had to disabuse them of the fact you can't have an outsider flying in to do your own local market surveillance. So there are those things that you'll do at that level. And then there are activities that really lend themselves to collaborative effort. Biologicals that Lambert also mentioned. None of us have the capabilities, or we may have scattered capabilities in country to do that. But if you can collectively come together and look at some of those are things that you can do at regional or continental level. It's the same with the active pharmaceutical ingredients. I know that the WHO is also looking at API manufacturers, but they are specifically focusing on their specific range of products. But Africa needs a broader range of products. So that is an area that collaboratively at continental level would be able to do.
Very good. Sorry.